While the government and the country's health workers battle COVID-19, some individuals are facing their own demons as they fight to keep their mental health in check. And on this year's World Suicide Prevention Day, various groups are urging those who are struggling to seek help. Faith Del Mundo with the story.
Months since the country has been placed under quarantine protocols, Bernadette finds it difficult to adjust to the so-called new normal. Despite staying at home since lockdowns were imposed in March, her remote work is eating up most of her supposed me time. Her constant fear of contracting COVID-19 is also taking its toll on her mental health. As she awaits her swab test results, her constant cough and colds make her worry even more, especially that her 65-year-old mother might get infected.
Recently, hindi talaga ako makatulog ng maayos, to be honest with you. Ayun nga, dahil nga sa sobrang, hindi ko alam kung ano yung mangyayari. Kasi, pumapasok sa isip ko ngayon, parang ang daming negative eh. No? And nagiging struggle ko rin talaga to balance my own thoughts and emotions.
Bernadette in fact says she was once diagnosed with depression and has had multiple attempts to end her life. Fortunately, it did not get the best of her. She joined a life coaching class and her outlook on life has since improved.
Malaki yung naging improvement ko when it comes to my emotional and mental well-being. Kasi sobrang laking tulong din sa akin talaga na I'm in a life coaching community and I also have my church family, and with all this support, nagbago yung perspective ko. I came to a realization that I wanted to get out of that situation.
Dr. Bernard Argamosa of the National Center for Mental Health notes that the lack of a support system, especially during this time, is really taxing.
Unfortunately, nagkakaroon ng mga suicide, nagkakaroon po ng mga homicide kasi yung kanilang defense, because of the overwhelming stressor, weeks of it, wala siyang support, mag-iisa siya sa buhay, nakikita niyang naghihirap yung kanyang kamag-anak, anak, asawa, kinuha niya yung mga dati niyang coping for the past days and weeks. Unfortunately, hindi talaga kaya. Yun, yung overwhelming situation na yun ang magbe-break sa isip ng tao. Kaya may mga nagkakaroon ng attempts to hurt oneself, hurt the family. Yun po yun.
For a mental health advocate group, family is everything right now as the country grapples with the COVID-19 pandemic.
The importance of family. Kasi kung sa pamilya pa lang, ma-address na itong mga issues na to, na galit and all, because of the values that we try to inject during their formative years, again, din maiiwasan yung mental condition, maiiwasan yung suicide. People will be open about their feelings without fear na hindi sila naiintindihan.
Okay.
As the world commemorates Suicide Prevention Day on September 10, the Catholic Bishops' Conference of the Philippines reiterates the role of the Church in helping those who have mental health problems.
Lalong-lalo na ngayon, Carmelo, na nasa krisis tayo, so hindi dapat na nawawala ang simbahan. Hindi dapat nawawala yung mga pastol, yung mga kura-parokong katulad namin. So we should make our presence felt. And so how do we do that? Medyo hampered din tayo ng physical presence. Kami po ay patuloy na nagbibisa. At sa mga mensahe na pinalalabas natin, there's always a message of hope. We can always find consolation in the Word of God. So that's always been the theme of our celebration.
According to the NCMH, they are now receiving at least 1,000 calls per month since the pandemic began, from 300 to 400 per month last year. Almost 500 of this year's calls are from people who are at risk of self-harm. Dr. Argamosa urges the public to set urgent consultations to mental health experts. If you or anyone you know is in need of help, please contact NCMH at 1553-0917-899 USAP or 8727 or 027989 USAP or 8727. For News 5, Faith Del Mundo, we are One News.